where two bones meet. Broadly, joints may be classified as movable or immovable joints. A joint is an area where two bones meet. Broadly, they may be movable or immovable. Movable or immovable. Most of the joints in our body are movable, but immovable joints are present in the skull. Immovable joints are present in the skull. It will be quite difficult if different parts of our skull started moving independent of each other. Therefore, the line joining the two bones is fused and they act as one single continuous layer of bone, and that's called the cranium. Yes, so these lines of meeting between two bones in the skull is called a suture. Example of an immovable joint is a suture, that is the area where two bones of the skull meet. Now, as a baby or in a newborn baby, the skull bones are actually separate and they have gaps, and those gaps are called fontanelle. They are called fontanelle. These gaps are actually present because the growth of the brain of the baby is not fully complete yet. So by the time the brain grows, these bones of the skull can be pushed apart by cartilaginous structures between them, but they fuse by the time the child is 1.5 years old or 18 months. The sutures in your child are complete or fused. That is, a movable joint is converted to a immovable joint by 18 months of age. Therefore, the gaps in the bones in a baby are called fontanelle. They're called fontanelle. Yeah, you have the anterior fontanelle, and that's called the bregma. You have the anterior fontanelle, and that's called bregma. You have a posterior fontanelle, and that's called the lambda or lambdoid fontanelle. That's called your posterior fontanelle. It's shaped like a lambda. It's shaped like a lambda. It's called the lambdoid fontanelle or the posterior fontanelle. So these are your two important fontanelles present in the baby, at which point your joint is a movable joint. The expansion allows for growth of the brain of the baby. After 18 months of age, both of them fuse and your joints in the skull are converted to immovable joints, at which time they are called sutures. Joints can also be classified based on the number of articular surfaces participating in the formation of the joint. Now, there are some ground rules that we need to remember while joints are formed. A joint is formed when two articulating surfaces of bones meet. These articulating surfaces are usually curved and they are in line with each other. The shape of the articulating surface is congruent, or it is accompanying the shape of the other articular surface. Now, these articular surfaces are covered by cartilage. All the articulating surfaces of bones are covered by cartilage, and the entire joint may be enclosed within a capsule, which is called an intracapsular joint, or the joint may be outside the capsule or a extracapsular joint. So, the articulating surfaces of bones are covered by cartilage, and joints may be inside a capsule called an articulating capsule, an intracapsular joint, or if it is outside the capsule, it's called extracapsular joint. Now let's classify the bones based on number of articulating surfaces. If the articulating surfaces are only two articulating surfaces, it's called a simple joint. Example, interphalangeal joints. All the proximal or distal interphalangeal joints come under this. They are simple joints where only two articulating surfaces participate in the formation of the joint. Next, a compound joint. Here, more than two articulating surfaces participate in the formation of the joint. Example, elbow joint, where more than two articulating surfaces meet. Next, a complex joint. This is characterized by the presence of an intra-articular cartilage. Intra-articular cartilage. This divides the joint itself into two locules, or it makes the joint bilocular. It makes the joint bilocular. Now, this intra-articular cartilage may be complete. It may be complete in the form of a disc. Example, TMJ or temporomandibular joint, the joint of the lower jaw. This is called a completely divided intra-articular cartilage. This divides the articulation at the joint into two locules. It makes it bilocular. This disc is complete. The intra-articular cartilage is complete or disc shaped. That occurs in the temporomandibular joint, or it may be incomplete. It may be incomplete, crescentic, or it may be crescentic. It's not a complete round structure. This part is missing. It's a crescentic. It's a crescent shaped disc. This is called a meniscus. It's called a meniscus, and obviously this is present in the knee joint. Incomplete or crescent shaped intra-articular cartilages are present in the knee joint. Therefore, this is called a complex joint. This is called a complex joint. So, example of complex joints, temporomandibular joint and knee joint. Next, combined joint. Here, the joints are separately placed, but they function together. They are separately placed, but they function together as one unit. For example, both the temporomandibular joints together form a combined joint. It is combination of more than one joints which act together, but they are placed separately. So, this temporomandibular joint and this temporomandibular joint, they do not act independent of one another, but they function as one single unit, and this is called a combined joint. Next, we classify joints based on shape and function. Now, depending on which axis they rotate in or move in, they may be classified as uniaxial, biaxial or multiaxial joints. Let's first look at uniaxial joints. Here, the joint moves around only one axis. For example, if this is the forearm, this movement, which is rotation, occurs along the horizontal axis. It occurs around the horizontal axis. This movement, which occurs at the proximal radio-ulnar joint, is an example of a uniaxial joint. This joint is also called that's the radio-ulnar joint. It's an example of a tracheoid or a pivot joint, where one bone pivots on the other bone. So this movement in one axis occurring at the proximal radio-ulnar joint is an example of a uniaxial joint called a pivot or a tracheoid joint. Tracheoid joint, example, proximal radioulnar joint. Next you have a hinge joint. For example, the PIP, which is proximal interphalangeal joint or distal interphalangeal joint. Proximal interphalangeal joint and the distal interphalangeal joint. They move along only one axis, that is the vertical axis. The only movement possible is the flexion or extension of that particular joint. Either the flexion or the extension. Similarly, proximal interphalangeal joint, flexion, extension. Now that movement around one single axis is called a hinge or a hinge joint. Example, all the interphalangeal joints of fingers and toes. That's another example of a uniaxial joint. Next we come to biaxial joints. Here the movement is around two axes. For example, if this is the movement along one axis, that's the vertical axis, the movement around the horizontal axis will be this. The movement along the horizontal axis. This allows for another movement called circumduction. It allows for another movement called circumduction. Obviously, these joints are so arranged, or the articulating surfaces so align to each other so that they particularly assist certain functions. Now there will not be any use having a circumduction at your finger, is there? At a metatarsal, at a metacarpophalangeal joint, if there's circumduction, there's really no point. But if there's a circumduction at the shoulder joint, it allows for various other functions. Therefore, these individual bones are adapted by size as well as movement in their individual axis to allow certain kinds of functions. Now you must remember that circumduction can occur only at a biaxial or a multiaxial joint. Now, biaxial joints can be divided into ellipsoid, condyloid and saddle joints. Ellipsoid joints, here the articulating surfaces are curved in two different directions, therefore allowing a lot of movement. This sort of ellipsoid articulating surfaces are seen in radiocarpal or the wrist joint. They have two articulating surfaces which allow a lot of movement. They are ellipsoid articulating surfaces. Next you have condyloid joint, where the articulating surface may be convex and the other side where it articulates will be concave. You have a convex articulating surface and the other articulating surface will be concave. This is the type of condyloid joint that you will see in the knee joint. The condyloid joint that you will see in the knee joint. Next you have saddle joint, where the two articulating surfaces are like a saddle, one astride the other. That example you can see in a carpometacarpal joint of the thumb. Therefore, examples of biaxial joints where circumduction is possible are ellipsoid joint, example wrist joint, condyloid joint, example knee joint, saddle joint, example carpometacarpal joint of the thumb. This picture shows you an example of an immovable joint. This is in an adult where these lines represent areas where two bones of the skull meet. This is the anterior end, this is the posterior end. Now here you have the frontal bone formed by two pieces, and this is the suture where two pieces of the frontal bone have fused. This is the parietal bone. This is the area where both parietal bones and your frontal bone are meeting. This area in a child is open as a fontanelle, and this area will be called the bregma or anterior fontanelle. Now if you come posteriorly, this is the occipital bone, two parietal bones. This area is another gap or fontanelle. This is the posterior fontanelle, this area. It's lambda shaped or inverted Y shaped. Now in an adult, any area where two skull bones meet, it's called a suture. It's called a suture, and this is an immovable joint. This is an example of an intervertebral joint. This is a multi-axial joint, and the example is a plane joint where the articulating surfaces are flat. So this is the intervertebral joints, which are multi-axial plane joints. This shows you the sacrum. It is a bone formed from fusion of the 5 sacral vertebrae and the 4 coccygeal vertebrae. This is the posterior boundary of the pelvic girdle. This is the sacral bone or the sacrum. This shows you the elbow joint. This is the ulna. This is the radius. This is the condyloid process of the ulna. Now, the condyloid process receives the articulating end of the humerus. The elbow joint has more than 2 articulating surfaces, therefore it's called a compound joint, and it's this proximal radio-ulnar joint, this area, the radio-ulnar joint, that is the proximal radio-ulnar joint, turns in one axis. That's a uniaxial joint or a pivot joint. Therefore, this is the elbow joint, which is a compound joint, and the proximal radio-ulnar joint is a pivot uniaxial joint. This is the knee joint, and this is a complex joint because the intra-articular cartilage divides this area into a bilocular capsule. This divides it into a bilocular area. Now, the intra-articular cartilage divides the joint into a bilocular area. This intra-articular cartilage is a meniscus. It's a crescent-shaped meniscus. This is the articulating end of the femur. This is the tibia, the articulating end of the tibia. It's a complex joint because of the presence of the intra-articular cartilage. It's a condyloid joint because the articulating end is convex and there is a depression in the other articulating surface. Therefore, it's a condyloid biaxial joint. This is the knee joint. This shows you the hip joint and the shoulder joint, which are both multi-axial joints. Hip joint is the ball and socket joint. This is the ball of the femur, which articulates with the concave socket of the pelvic bone or the hip bone. So there's the ball, that is the socket, that is a ball and socket hip joint. Shoulder joint also is a ball and socket joint. This is the articulating end of the humerus, and that is protruding into the glenoid cavity of the shoulder joint. So the head of the humerus is the ball, the socket is the glenoid cavity of the scapula. This is the ball and socket shoulder joint.